Good morning. Thank you for the opportunity to speak to you about Watson. Just to give a little background as to why I'm even here speaking. I am a technologist after a fashion. I am not a computer scientist or a computer architect, so control your questions in that direction. I started my career 45 years or so ago in healthcare, biomedical engineering across the river here at MIT, working in areas of information theory and pattern recognition in healthcare signals. Then went on to medical school, practiced emergency medicine for 30-some years, became a healthcare executive, then went back to school a couple of more times, some work in healthcare management and policy and finance. So I'm basically here because I can speak the languages of most of the stakeholders in healthcare, having also been a patient, although not volitionally. And so talk a little bit about Watson and its role in healthcare. Okay, I'm assuming most of you are aware that Watson defeated the reigning Jeopardy champions just a little over a year ago. Is there anybody who's not familiar with that? Okay, so Watson is a natural language processing tool. It understands English, not just recognize the words, but actually understands English. And Jeopardy was chosen as the arena within which to demonstrate Watson because it's known throughout the English-speaking world. It uses intentionally arcane and obscure language in its stimuli, and as you know, Jeopardy gives you an answer and you have to formulate a question that's appropriate for the answer. But it uses puns, nested questions, kind of structures that humans can intuitively work with, some better than others, but up until now computers had not managed very well. So Watson, Jeopardy was the target for Watson just to show the profundity of its natural language processing ability. So if we look at Watson just about a year ago when it played Jeopardy, it was English only, which is still the case. There are plans for it to in the future include other languages, but that's a major challenge because this is not just recognizing words and even translating the words. This is actually understanding the intent of the statement, which is a much more difficult challenge. So there will be other languages at some point in the future. It was a single question, single responder in the Jeopardy environment, and it was constrained to a 3-second response time because that was the Jeopardy rule. And so it had to understand the answer that was posted on the Jeopardy board, research in stored data. It was limited to stored data under the rules of Jeopardy, so it had 15,000 gigabytes of storage ability for literature that it would use to come up with the response to the answer. And it was static content. It was unable, not allowed to use the web during playing Jeopardy because that was the rule of the game. And in fact, it had to respond in fewer than 3 seconds to beat Ken Jennings, because Ken Jennings, who was the leading champion, generally buzzed in with between 1 and 1.5 seconds. And when he was interviewed as to why he could do it so fast, he said he buzzed in based on the assumption that given the category and the question, by 3 seconds he would know the answer. So he buzzed in before he knew the answer, just with his confidence that he would know the answer in time. So Watson had to do all this reading. And the Watson that played Jeopardy was able to read and understand 200 million pages of text in 3 seconds. That was what required to play Jeopardy. And it took about 4 to 5 years to develop Watson to play Jeopardy. Their original structure was starting off with basically a super database. So it would collect enough information about previous questions to have a database of likely answers. It would search the database, and that structure turned out to fail miserably. It did not work at all. So they went to a system they call massively parallel probabilistic algorithms without any use of a database or remembering previous answers or anything like that. So it approached each new stimulus, each new answer as a completely new challenge and addressed it from scratch. And they found that the fewer rules they put into this analysis, the better it did. So they have hundreds, up to something in excess of 1,000 of these different mathematical algorithms that they use to analyze, understand, and engage in the effort to find the appropriate response. And it had to be trained. So Watson was trained by being allowed to play against thousands of previous answer question couplets from previous Jeopardy sessions. So our future is it's going to be multiple users, not just one. We won't be constrained to a 3-second response time. Very few decisions in healthcare have to be done within 3 seconds. It'll have additional languages, and it'll exist in an arena with other kinds of analytic tools. Watson is strictly natural language processing. Okay? It can use structured data, but that's not its principal talent. It's natural language processing. So if Watson were to exist and work with other tools that interpret images, evaluate structured data, and those tools provided inferences that could be fed into Watson that Watson could use for its deliberations and its natural language processing, then Watson becomes even more powerful. So that's the view we have of it for the future. And why is Watson important? Well, you'll be pleased to know that the senior leadership of IBM very quickly determined that playing Jeopardy was not a long-term business model. Okay. They needed to find something else. So looked for an arena of human endeavor that was important, that also relied on arcane, obscure language meant to minimize understanding, and they came up with healthcare. Healthcare has many challenges in language, the multiplicity of its language, the ambiguities in it. So it was a good opportunity for natural language processing to come into it. And the array of information that impacts healthcare, the unstructured data, is phenomenal. So we have electronic health records, we have journal articles, we have the social media. Over the last couple of years, the impact of social media in healthcare has been fairly dramatic, to the point where the NIH has had to change its approach to healthcare research because of it. I attended a Future of Healthcare seminar at the NIH just about 2 years ago, maybe a year and a half ago. And they were talking about the future of healthcare research and talking about the gold standard of research, which is the double-blind randomized controlled study. And the usual challenges of that, how expensive it is to acquire a patient population, what a challenge it is for physicians to participate in it. The study can take 2 years and you may not get a result, all the usual challenges. But a new challenge is the social media, because what they learned is that by going out into these various social networks, individual members of individual patients in these studies were discussing it with other people out there and able to identify through these communications that they were actually in the control group of a study and dropped out. So there's, strangely enough, as people are willing to share personal information about their healthcare out on the web, more so than they're willing to do with their physicians, enough to impact research protocols. So where does Watson fit in then? If we look at the goals for the transformation of healthcare, and one of the previous speakers was talking about some of the challenges we have of its inefficiency, the expense. A lot of the expense is based on decisions that are made without using evidence. So there are some estimates that 20 to 30% of every dollar spent in healthcare is spent on something that's either useless or frankly dangerous. Okay, there's redundancy. When I practiced in the emergency department, the last few years of my practice, I was in a hospital that was within 5 miles of 5 other major hospitals. And because of emergency medical service rules, the patient who called an ambulance went to the nearest hospital, not necessarily the hospital where they were getting all their care. And the number of times patients would come in having recently had an expensive test like an MRI or a CAT scan, but having no idea of the result, and I had no ability to get that information from that other source, of having to repeat these tests, which is clearly a waste of time, money, additional risk for the patient. So the goals for healthcare overall, and where we think Watson fits in, is improving the quality of healthcare, reducing errors, advancing the cause of evidence-based care. Depending on the study you read, somewhere between 15 and 50% of decisions in healthcare are actually evidence-based. Okay? And there's no possibility of becoming more efficient or more effective if we don't improve the fraction of questions that, decisions that are made on evidence-based. So the overall idea is getting the right content to the right person in the right format at the right time to help improve decisions. And this information can exist anywhere. It can be from publishers of journals. It can be healthcare providers, their own records, from benefits providers that have large amounts of information about utilization and in the public domain. And Watson can access all of this. So it understands the nature of the question, that a physician or any healthcare decision maker has to make. And then understanding that goes out into all these sources to bring back information that Watson deems relevant to the decision at hand. Now, if you actually watched any of the Watson Jeopardy contests, below the Watson avatar, when Watson was coming up with a response, there were at least 2 other responses listed with numbers associated with them, fractional numbers associated with them. Those were other responses that Watson had considered, and that number represented Watson's confidence that this was relevant to the Jeopardy question. And if the answer in which it had the most confidence exceeded a threshold, then Watson would buzz in and offer that as an answer. Because as you know, in Jeopardy, if you're wrong, you lose as much money as you would have won. And even within the context of the game, Watson would recalculate the threshold in a dynamic way depending on the position in the game. So if Watson were way ahead and say losing $400 or $600 was of no great consequence, it would set a lower threshold to buzz in. If it were a very tight game, then it would set a higher threshold because it could not afford to lose the money. So it did all this analysis along with the natural language processing. So we see Watson sitting in here, and so very analogously, working with, say let's use an example of a physician making a diagnosis, understanding the information about the patient, the nature of the diagnostic question in hand, seeking all sorts of information from these other sources, and bringing it back to the physician as a list of suggestions for the physician to consider, with each one assigned a confidence level that this is relevant to your decision. Okay, so just as in Jeopardy, it's going to come up with a long list. Now, as distinct from Jeopardy, healthcare is inherently less deterministic. Okay, there may not be a single answer. So the goal for Watson in healthcare is not to come up with the single answer that it had to come up with in Jeopardy, but to come up with a list of suggested considerations for the person making the decision based on the understanding of the question at hand and all this information, the 200 million pages of text that Watson can read in 3 seconds and come back to you for that information. So one way to look at Watson, and a major way to look at Watson with respect to healthcare, is helping move towards this evidence-based, better use of information that's out there. Studies show that for the typical physician, or most physicians spend 5 hours or less each month reading. Not because they don't want to, just haven't got the time. They're too busy seeing patients, making rounds, dealing with insurance companies, whatever, and they can't do that. Every one of us, when I was in practice and running emergency departments and residencies and running trauma centers, I had subscribed to lots of journals. So I had emergency medicine journals and cardiology journals and trauma journals and education journals and management journals. The only question was how high the stack of unread journals would get before it fell over. It was information that I wanted to have. I would love to have it stored if I had the time to read it and if I had the memory capacity. Watson doesn't have that constraint. Okay, Watson can read 200 million pages of text in 3 seconds. So imagine yourself sitting in a situation, you have to make a decision. You have a buddy sitting behind you who understands the question you have to answer and says, I just read 200 million pages of the most recent information. Here's some ideas for you to think about. Okay, that's how Watson works in healthcare. And in some ways, I view it as some of the nurses that helped me out early in my career. I started practicing emergency medicine in 1975. I was one of the very first few people to actually finish an emergency medicine residency. So I thought I was pretty hot stuff, but I knew a lot less than I thought I did. And so I recall more than several times in the emergency department at the end of a long shift, dealing with a complicated patient, being a little tired and not as knowledgeable as I thought I was, sort of getting into trouble. And one of these nurses, and I remember the 3 nurses and their names, would lean over my shoulder and say, did you think about such and such? I said, damn, that's it. And in a way I view Watson as that same friendly advisor, bringing the information to you that you would want to have anyway. So let's give some examples of how Watson is different from other kinds of question support tools that we've used in the past. Watson understands language. It's not a lookup, it's not a database query. So let's look at differences of how a question would be asked or answered and where Watson is different from others. Okay, if you were to ask the simple question, where was Einstein born? Okay, you could use a search engine or any of a number of things, and most computers would come up very quickly. It was Ulm. Single fact, well known, not a big problem to understand. But if we asked it this way, which was an actual stimulus from Jeopardy, one day from among his city views of Ulm, Otto chose a watercolor as a gift to Albert Einstein as a remembrance of Einstein's birthplace. To infer from that sentence that Einstein was born in Ulm is a much more complex analytic challenge. Not a simple lookup, would not do well in just a search engine. Take another example. Who ran General Electric? Okay, Jack Welch, or what did Jack Welch run General Electric? An easy, simple question. But if it's phrased this way, if leadership is an art, then surely Jack Welch has proven himself a master painter during his tenure at GE. So, and this was an actual stimulus from Jeopardy that Watson got correctly. And amongst the phrases in here, it had to understand that master painter didn't mean somebody who has an oil on the wall at the Metropolitan Museum. But this meant something far more subtle. This is the kind of language that Watson can analyze and understand. So how does Watson work? At a very high level, because a reminder, I'm not a computer architect or engineer. Watson breaks down and understands the question using any of these hundreds of algorithms. And then it goes to something it calls answer sources. When it was playing Jeopardy, it learned itself that certain sources were very good for getting answers, or the question responses to the answer that was the Jeopardy stimulus. It intentionally went out and sought a very long list of answers. It could have been hundreds of possible responses to the Jeopardy stimulus. Okay. And one of the reasons it did that is if it didn't include the response on that long list, it didn't consider it any further. So it intentionally went out for a long list of possible responses. And it found on its own that Wikipedia, for example, was a very good source of answers. Now, all sorts of criticism about Wikipedia. It's not edited, not reliable, but it found that it was a very good source of possible answers. It also learned where to go to first based on its experience. So it set kind of reliability scores for each of these sources. So Watson learned very quickly that if the stimulus in Jeopardy was about the film industry, the first place to go was the IMDb database, which is about the film industry. So it went to these sources to collect these answers. Then it went to another set of sources it called evidence sources. And it used the information it learned from these evidence sources to evaluate each of the answers on this long list to decide which answers were in fact most appropriate for the response it had to make to the Jeopardy stimulus. And it would assign a confidence level to each of these. And some of them may have been very, very low, like 0.01. Some of them may have been 0.8 or 0.9. And it came up with that list. And then if one on that list exceeded the threshold, Watson would buzz in and offer the answer. So analogously in healthcare, okay, it is not our goal to come back with a single answer because there often is not a single answer in healthcare. Watson will go through the same process, look for answers. So if we're doing a diagnostic challenge, then it'll look for a long list of possible diagnoses from its answer sources, then go to its evidence sources, and evaluate each of those answers, and then come back to the clinician with a list of suggestions. These are diagnoses with various confidence levels that I think you ought to consider. And further, if the physician wants to learn more about why that suggestion was made, they can link back through that suggestion, and Watson will take them to the evidence that it used to create that suggestion. So again, it's giving you access to information, helping you make decisions, not making decisions for you, but bringing you information to help you make a better decision, allowing you to research that information if you want it. And on the other hand, you can ignore every suggestion Watson makes if you disagree with it. But Watson is coming back with these suggestions for your consideration, not making a decision for you. And just as Watson had to be playing Jeopardy, had to be trained to play Jeopardy, Watson is being trained to play healthcare. So we started off with sort of basic multiple choice questions like doctor's dilemma, some of the materials used for training for certification exams, where there was at least nominally a correct answer, and see how well Watson did with it. And now then we're moving on to actually analyzing scenarios, because healthcare is not multiple choice questions very often. And we've all had experience with people who do extremely well on multiple choice questions, but are relatively useless in the real world. So we're not stopping there. We're moving on. So I guess another example of difference between Watson and the search engine. One of the actual, again, questions in Jeopardy was, in May 1898, Portugal celebrated the 400th anniversary of this explorer's arrival in India. Somewhere else in the blogosphere, there's in May, Gary arrived in India after he celebrated his anniversary in Portugal. So on a keyword basis, that's an exact 5 keyword match. So if you were using a typical search engine with that information, that search engine would take you to pages where those keywords appeared. And by prioritization, the page about Gary would be high up on the list of hits. But I think it's unlikely that Gary is the explorer that they have in mind. So how would Watson go about analyzing that same stimulus, which it did and got it correct? I mentioned it uses hundreds of parallel algorithms, mathematical parallel algorithms. So at a very high level, 3 of the algorithms, the categories of algorithms are temporal reasoning, statistical paraphrasing, and geospatial reasoning. So Watson would, May 1898 and 400th anniversary aligns with 27th of May, 1498. Arrival in, paraphrased, could have the same meaning as landed in, and Kapit Beach is in India. So along with all the other algorithms, these would be 3 kinds of algorithms it would use. And on that basis, it would come back, having found this other statement in some historical site, with actual suggestion, Vasco da Gama is a name for you to consider. And in this case, it would do it with a high confidence level, not 100%, but a high confidence level. And this, in fact, was the response that Watson suggested and got correct in this particular contest. So you can see how it's different from a search engine. So how does this carry over to healthcare? Well, temporal reasoning, the temporal progression in working with a patient is an important part of clinical decision making. 3 or 4 months ago, if I ran 2 blocks, I got chest pain. Now, if I walk up a flight of stairs, I get chest pain. That progression is something we pay attention to in making decisions. Geospatial reasoning is entirely analogous to anatomic reasoning. The pain started in my fingertips and then moved up to my shoulder, and now it's in my chest. So that kind of progression carries over from geospatial. Statistical paraphrasing, probably the most obvious one in healthcare, is the difference between how patients use terminology and how clinicians use terminology. Okay. We have technical definitions in our mind of certain terms, but they're not the same that patients use. So, for example, a patient tells me they're dizzy. Okay. In my mind, dizzy technically means vertigo, the room spinning around. But patients use that term in a whole variety of other ways. I'm weak, I'm depressed, whatever it happens to be. So if I focus only on the technical definition, I'm basically misinterpreting what the patient has said to me. Watson understands this ambiguity of language. So if I were to tell Watson the patient is dizzy, along with other information, Watson might well come back with some suggestions for me, but it would also say, dizzy is an ambiguous term. These are my suggestions based on what we have right now, but if you tell me more about what the patient means by dizzy, then I can do a better job in giving you suggestions. So dealing with that ambiguity of language is very important in healthcare. And so Watson has basically 5 singular characteristics. So it interprets and understands natural language questions. So you can ask the question to Watson, what condition has red eye, pain, inflammation, blurred vision, floating spots, and sensitivity to light? You don't have to break it down into keywords. It looks at large volumes of literature, and it can be anything. It can be physician's notes, anything that is text or text-like. Journals, path reports, the results of clinical trials, the Wikipedia, if that's relevant. And it can read through any of that at these huge rates of basically 60 million pages of text a second. And it comes back with responses that are quantified, and the quantification is Watson's interpretation of the relevance of this, not the likelihood that this is the answer, but that this is relevant to your decision making. So we'll come back and say, I am 91% confidence that uveitis is something you ought to consider, and 29% confidence that keratitis is something you ought to consider. Not that it's, these add up to more than one, so it can't be an actual confidence that this is the singular diagnosis. And it is iterative. Watson can ask for more information and then reprocess it and revise its evaluation. And that iterative information can come from the patient, from the physician, from the electronic health record, wherever the information is needed. Watson can go out and look for it, and if it can't find it, it'll ask the physician for it. And it learns from its mistakes. It learns, the more it plays healthcare, the better it'll get. And since we're not constrained with stored static data now, it's always able to go out and read the most recent literature. So when, going back to that slide of how Watson works, Watson takes each question from scratch. Watson is what's called stateless. I'm not a computer architect, but one of the computer architects explained that to me. It means once it has processed the question, it remembers nothing about it. Okay, it's wiped out. The learning that Watson gets is in how it adjusts the way it processes information, the weighting of its algorithms, which algorithms are brought into play for which kind of question. But it doesn't store a bunch of previous answers to use as a resource. It forgets everything that it had about that patient. In healthcare, that has 2 points of relevance. One, since it doesn't retain that information, for instance, when it comes up with this list of answers based on the information you've given it, and it asks for more information, you feed back that additional information and it starts from scratch again, looking for a whole new set of answers, because the new information may push it to find some answers it hadn't thought about before, so it is not constrained by previous answers. And then the issue of protected health information, since Watson doesn't remember anything, okay, there's not much opportunity for it to leak protected health information. And so the way it would work with working with a healthcare organization is the healthcare organization would remain responsible for the integrity and privacy of the data. And so if they were to submit information to Watson and Watson would come back and say, okay, I need some clarification, all the original information plus the new information is kept by the healthcare provider or the healthcare organization, and then they feed the whole packet back to Watson and it starts from scratch again. So Watson keeps none of that information on board. We spent the last year and a half meeting with a large number of healthcare organizations to get their ideas on where Watson can help. And part of that was teaching on our part, because Watson became so famous so quickly after Jeopardy that the number of healthcare organizations that wanted Watson just exploded. But a lot of them wanted it for things where Watson really wasn't didn't have a good role. They were, I have this huge database of data that I've never analyzed. We want Watson to do that. But it was not database that amenable to natural language processing. It was all structured data. So some of it was teaching and making sure that people understood the special contribution that Watson could make. So we came up with 28 or 30 different kinds of use cases that were suggested to us that were relevant to Watson. I'll talk about a couple of them here. The basic backbone of it was the patient inquiry, workup, diagnosis, treatment, and follow-up. And everything else was kind of a play off this. So I described a little bit about how it might work in a diagnosis situation. Another one, and one of our current, in progress projects, is treatment authorization, pre-authorization for payment for treatment. We're working with WellPoint on that project. Now, offhand, this might seem like fairly trivial. Okay, this process of making a diagnosis, submitting a request for payment for treatment, and then getting the response back. But it actually is a quite important role in healthcare because of the way our healthcare system is structured here. It's a very expensive, very time-consuming, very frustrating process for everybody, for payers, providers, and patients. There was an article in Journal Health Affairs last fall that compared American and Canadian physicians and concluded that for the average physician in the United States, the cost of interacting with payers is $85,000 a year. That's the cost of the physician's time in filling out paperwork. That's the cost of salaries and so on for billing staff. $85,000 a year, principally because of our multi-payer system. By comparison, the average Canadian physician is $21,000 because they're principally a single-payer system. So, and that came out to be 16% of practice revenue. So basically 1/6 of the practice revenue is sterile, wasted, useless stuff playing to interact with the payers. Now, the payers have a similarly expensive bureaucracy. They have a cadre of nurses that evaluates these requests. They either approve them or send them on to a physician panel. Roughly 10% go to a physician panel for further consideration, or they send it back because it's incomplete. And this can take 3 or 4 weeks. And in the meantime, the patient's sitting at home. The patient just had a diagnosis of cancer and wants to start treatment yesterday and is waiting to find out if they're going to get their treatment. So if we have a system, a way of improving that, then it's a win-win-win. The patient wins, the provider wins, the payer wins. And so that's what Watson is working on right now with WellPoint. And it's working with the nurses panel, using guidelines that exist for making those decisions in the process of making this more efficient and less costly. And so, if nothing else, Watson is immediately interactive. If it gets information that's incomplete by the guidelines, it can immediately get back to the physician and say, I need a little more information, not wait for exchange of emails or snail mail that takes weeks and weeks at a time. So it's actually a potentially important role, and it speaks to one of our goals with Watson, is Watson being an enabler of the collaborative model of healthcare that we need going forward. If we're going to make these major changes in healthcare, all the stakeholders in healthcare have to play together, and this is one way of doing that. We also have a potential consumer portal role for this, or an Ask Watson kind of role. One of the other goals of healthcare is empowering the patient. An empowered, knowledgeable patient is a better manager of his or her own healthcare and better able to participate in the decision process for healthcare going forward. So imagine an integrated delivery network, one of the ones that perhaps that was talked about before, where the patient has a primary care team, say a care coordinator, and this organization offers to that patient, Ask Watson. The patient can enter a question in his or her own natural language, doesn't have to make up keywords or understand technical terms. If Watson has the permission, Watson can look at the patient's electronic health record and bring back personalized suggestions to the patient. At the same time, this information will be shared with the care coordinator. So not only does the patient have access to personalized evidence-based suggestions, but somebody to talk to about it. So this carries on towards the goal of the empowered, knowledgeable patient, which is globally one of the goals. The World Health Organization, all these want to move in that direction. So just quickly, if we look at some potential role for Watson in the diagnostic process. This is a flow diagram from an article in the New England Journal of Medicine about one physician's conceptualization of the diagnostic process. And it has several steps. You hear the patient's story, you get some information, you start to formulate an idea of what's going on here, you generate hypotheses for diagnosis, you search for a little more information to support or challenge those, and eventually you make your final diagnosis. And it's influenced by the knowledge of the clinician, by the context. It's different if it's the emergency department than a primary care physician's office, and the experience of everybody involved. But if you look at these steps, each of these steps has the opportunity for error. And from research and decision making, we have some good ideas about 5 or 6 major repetitive human behaviors that get involved in errors in decision making. And so one of the errors is the flaw of availability, which is you're not going to think of something you don't know about. And so when you hear some early points from the patient, you immediately start to formulate some ideas of a diagnosis, ones that you know about. And then there's a second human pattern of behavior that comes in called self-reinforcing perception bias. Okay, you then, having come up with these diagnoses, you then listen specifically for information that supports your original hypotheses and suppress information that would tell you you've gone off the deep end. The combination of them leads to a very high rate of error in diagnosis. It's estimated that 25 to 30% of clinical errors are in diagnosis. And so there are other similar patterns. Well, how does Watson mitigate against that? Okay? Watson doesn't have bias, and Watson doesn't make premature decisions. Okay? So it seeks all the answers, then goes to evidence to evaluate them, so it doesn't do anything prematurely, it's not biased. So it keeps all the relevant suggestions in front of the physician all the time. So it helps mitigate against that kind of behavior. So where does Watson fit in with another area we need help in healthcare? The electronic health record. This is a summary of an article from 2 Harvard professors, Gordon Schiff and David Bates, about the limitations of electronic health records. Fundamentally, electronic health records are passive data storage. Okay? They don't do a lot of things to help improve our decision making. And Schiff and Bates identified some of the things that we need that electronic health records don't give us that are necessary to improve diagnostic decision making. Okay? And one is prioritizing the evidence or the information in the electronic health record to the context of the decision. Okay, electronic health records can have a huge amount of information. A lot of it is text-based. There's no way that you can use your electronic health record to prioritize the information in that record to give you information that's contextually relevant to the decision you have to make. If you're taking care of a 65-year-old woman with chest pain, you don't want to learn about the wrist fracture that she had at age 11, but you may have to go through that. And recording and sharing information, electronic health records don't tell you what information is missing. It tells you what's there, but it doesn't tell you what information is missing. Watson will do that. Okay. And it doesn't prompt you to ask questions or seek additional information. Watson will do that. So you can read all that information. The electronic health record won't help you decide what test is next best based on the information you have. And it doesn't provide access to information sources, but where's the evidence to support what we're talking about? It's not in the electronic health record. Watson does that. So for each of these 4 deficiencies in the role of electronic health records in decision making, Watson helps. So just quickly, to see how Watson would work, let me show you how Watson would manage an actual case scenario. Okay, this is an actual case description from the New England Journal of Medicine. Fairly complex case, and as you know, that on a regular basis they publish these cases, almost all of which have had some unfortunate outcome, and its analysis of why it got there. So the first thing that Watson does is judge the categories in which the words fit: symptoms, diseases, medications, modifiers. Modifiers are important because obviously no chest pain is very different from chest pain. And that looks at the associations. Where do these words, terms fit in? And so for patient had fever, anorexia, and frequent urination. Watson would say, okay, that fits with my reading that this is urinary tract infection, so I'm going to include urinary tract infection as one of my suggested diagnoses. But these other findings or symptoms on the left do not, so I'm going to have to look for something else. Watson breaks down the evidence that it uses into categories. And for this case, it would be symptoms, family history, personal history, et cetera, and evaluates its suggestions based on each of those categories of evidence, and then puts them together for an overall confidence level. So it would look at symptoms and symptoms that were important for their absence, family history, patient history, medications and findings such as physical examination findings or lab results, and put this all together and come up with an overall confidence in certain diagnoses. So here it would have come up with urinary tract infection and diabetes as being diagnoses to consider with high confidence. And in fact, those were the diagnoses that the patient's physicians came up with, and they started to treat her for those and sent her home. What they missed was that her more serious diagnosis was metastatic breast cancer. She had no known history of breast cancer, but they did not identify that till she had a fatal event a couple of months later. The reason she was diabetic is one of the metastases was to the pituitary, which is the part of the brain that controls hormonal regulation, but that was missed. What Watson would do in this case, at the very least, is say, okay, I have confidence in these suggestions, but there's something else going on here. We're not done. Because one of the variations on the flaw of availability is the incomplete diagnosis. I've come up with these 2 diagnoses, I've done my job, I'm moving on, without considering that maybe there are more diagnoses to be identified. And so that's another distinctly identified behavior pattern that leads to error. So if we look at Watson overall, just to finish up, Dave Ferrucci, who was the leader of the team that created Watson, views Watson reasoning as shallow. By shallow, he means it looks at huge volumes of information. to collect suggestions to be considered. Doesn't make that final deep dive into the decision, but does it very broadly. So in a sense, in a shallower way. And it looks at EMR data, literature, whatever may be available. It's unbiased. It learns from its experience. It's not limited by a database. And it does not make any premature judgments. It considers every possibility it can come up with before it evaluates and returns suggestions to you. So it hits this sweet spot for us. Humans behaviorally are very good at taking a limited set of suggestions and deciding which one or ones amongst those suggestions are relevant to the case at hand. Far less able to process huge volumes of information. So Watson helps us with that, with our limitation. And it comes back with suggestions because healthcare is inherently uncertain. There very often is not a single answer. Watson will tell you what information is missing. So we can say, okay, I have these suggestions. My reading of the literature says that if you do test XYZ, that's the next piece of information that's most likely to allow me to reconsider my confidence levels in these suggestions, and so you may want to think about doing that. And it's interactive. It can request information, it can ask for a suggested test, and in this interactive process then allows the clinician and Watson to work together to zero in on the evidence-based decisions. So again, we view Watson as truly as clinical decision support, not a clinical decision maker. It gives you the opportunity to learn from huge volumes of relevant information to help you make better decisions. It won't make the decision for you, just provides us that which we want, is the ability for us to make better decisions because we have more information. Thank you.